Very, very inspiring. We do have time for a couple of questions if there are some thoughts you'd like to share, some questions you'd like to pose for Dr. Roper. This is really a wonderful opportunity. Someone who has had really worked at all, and I mean all elements of our health system. So, Shoshana.
And I'm not getting choked up. I just have a dry throat. Go ahead. Right.
I was really struck by the last comment that you made, because I struggle in my classroom sometimes to get my students over the concept that politics is a dirty word.
Right.
And I guess what I was listening to also was the fact that most people in public health have not gotten training in political science to that extent. What's the policy-making process? I'm wondering whether or not you, in your wisdom as having been both an educator and also a practitioner of that blended version of politics and public health, what advice can you give us about how best to increase the extent to which people in public health understand the best uses of a political mindset, if we could put it that way?
Thanks. It's hard for me to talk about what the whole field should do. I just answer a part of your question by saying what we do at our medical school. In our first year of med school, we have a course called Health and Society that involves learning about health systems and healthcare financing and so on. And part of it is an exercise that the students really get into and love, which is role playing, where one of them is a hospital administrator and one's a government official and one's a patient and one's a doctor and so on. And the practical point of it is, as your question implies, learning about how this really works. And it's not quite the same as an abstract lecture course. It's down and dirty and trying to get something done. I'm inspired by participating, as I do, and I did last week in this each year as one of the course people, because students these days, most of my experience is now in a medical school, but I trust it's the same in schools of public health, are remarkably idealistic and committed and want to change the world, and it's an exciting thing to get involved with them. But the message that I try regularly to give, whether in that setting or in one-on-one meetings that I often have these days with students, is to say the best preparation for what you want to do in the future. And candidly, many times folks come to me and say, I want to do what you did. How do I get there? And I say to them, the best training for you to get there is to do the very best you can in what you're doing right now. And don't worry what's over the hill, because every job I've ever had has been a surprise, and so go for it. But I think we're now doing a thoroughgoing overhaul of our medical curriculum, and we're going to build even more of this into it. I think a lot more of these kind of things is what practitioners of medicine and other health professions are going to need. Frankly, it's been a while since I used the Krebs cycle, which is one of the things I learned in freshman med school, but I think I could have used a whole lot more of this kind of thing. Anybody else? I don't see a hand. Yes,
Hi,
ma'am.
I'm Teresa Green. I'm at University of Rochester in New York. I'm being charged starting in July with teaching the medical students, all of them that come through the program, about community health. And I have them for a month, and I need to teach them the importance of community health. And I'm struggling. I have my perspectives, but I wondered yours as a physician moving into community health, what I should tell them to make them incredibly interested in learning more. I think a lot of them think if they work in the clinic, in the city, that's community health. I'm teaching them that it's more, but why would a dermatologist or an anesthesiologist want to know that?
Well, you know, the big thing for organizations like ours and yours and UK Healthcare is under the Affordable Care Act, how do we become accountable care organizations, and what does that mean for population health? And If you've not seen it, I would commend to you an editorial or piece that was in JAMA about 3 or 4 weeks ago where folks were talking about what does population health mean for our kind of organizations. Is it the health of the sum of the population that are our patients, or does it mean we in central North Carolina take a responsibility to influence the health of the people who live in the 7 counties around Orange County where I live? All those things are up for grabs, and it's an exciting thing to talk about that. And I'd encourage you to push people to, because this is getting us way outside our comfort zone. You know, the organization that I'm privileged to lead these days did a very good job over the last several years of admitting patients to hospitals and doing high-cost surgeries and imaging and whatever else. Being interested in and even responsible for the health of 1 million people in our area is a much different question. Yes, Dave, one more, and then I'm going to have to run to the airport. Excuse me.
A force pushing, potentially pushing medical care delivery and public health closer together. So the flip side of the previous question, I'm curious what your thoughts are. What would your comments be to public health practitioners, state and local particularly, for working with healthcare provider organizations today?
Sure.
What concrete steps would you recommend they take?
So it's a real opportunity, but truth be known, for decades, maybe 100 years, people have been talking about the need to bring public health and medicine closer together. So this is not a new thing, and the ACA is yet another opportunity, but you know, we've muffed it in the past, so here we go. The number one thing I would say is there's just no substitute from getting to know each other and working together. And as I used to say when Glenn and I were together at the School of Public Health at UNC in the late 90s and early 2000s, I used to hector our faculty and students to say, you know, I understand how you want the local hospital administrator and medical group administrator to sit down with you and talk about working together, but you know, what I hear on Monday, Wednesday, and Friday is you saying how they are money-grubbing capitalists who are not worth what they're doing, and they ought to be driven out of the country because it ought to be immoral to do the jobs that they're doing now. That's not a very good way to set up a constructive conversation. And the other thing that I think that stands in our way is the two fields, broadly speaking, and I know public health is a holding company for lots of subfields, but the two fields, broadly speaking, exist so far apart. In our little town of Chapel Hill, they are right on the other side of the same street, but we exist in separate schools and separate degrees, and people dress differently. I mean, there are not many earth shoes in the medical school. And you know the points I'm making, and unless we really spend time with each other and work on these things together, there is no hope of bringing it together. I've enjoyed it. I hope I've given you something to think about. Thank you.